I'm Dr. Cynthia Diehl. Today we're going to show you a labiaplasty surgery on a little flower. This is a surgery that we do very commonly here. It's a great surgery for patients that have a lot of discomfort due to the labia minora. These are the labia minora. This is the clitoral hood. And so that's what we're going to be working on today. There are a bunch of ways to do this surgery, and I've done them all. There's a central wedge, an inferior wedge, but my favorite technique is the trim technique. It gives us a very predictable result. It leaves excellent blood supply, so the wound healing is really good, and it leaves a beautiful scar. So what I do with patients first is I draw and I put lines to sort of show the labia that we want to trim. And we want to leave sort of a natural arc of tissue. We want it to look like you could have been born that way. The important thing to note about labias is that there are a very wide variety of normal labia. So it doesn't necessarily mean that the patients are abnormal. It's just that they have a prominence of tissue that protrudes and rubs and irritates and bothers them. So once we've marked the labia that we're going to resect, we inject local anesthesia. If they're not having general anesthesia, you don't have to have general anesthesia for this. We get them nice and numb, test to make sure that they're really numb before we start doing anything. And then with the scalpel, I don't usually use scissors, but with a scalpel and electrocautery, we trim down some of that excess tissue. So we're going to do that now. And there's our resected labia. So once we've done that, normally we cauterize, make sure that all our bleeding's controlled. And then I put deep stitches in, which I can't really do on this little plastic flower. So I'm going to show you the external stitches that we do. So normally we're putting deep stitches in to take some tension off of that closure. But then we take this suture and we just pass it through. You get the idea. We're just sewing those two edges together. These stitches actually dissolve, so we don't have to take them out. Somewhere between 10 and 14 days. Okay, so we just finished our labiaplasty on our flower, and our flower is feeling just fine. You can see our suture line here. We've trimmed off this part of this labia, and then our suture line on the other side, where we've trimmed off this part of the right labia. So the last thing we do is put a little bit of antibiotic ointment on that little wound edge, and we give them some frozen peas to go home with.